I'm drinking coffee today instead of alcohol.
Look at you go.
I'm very healthy.
My Monster has B vitamins in it, so
That's practically a smoothie.
yeah.
It's girl dinner.
I love girl dinner. I love what it is. I eat that all of the time. I'm not a fan, though, of appending the word girl to things that are like essentially kind of a shittier half-ass version of the original. I feel like it's kind of denigrating.
The antithesis to girl dinner, though, is boy math. So that's the other end of the meme. It's a two-sided meme.
Okay, so
There's
tell me
girl
more
dinner.
about boy math.
Boy math is that this is 8 inches. Boy math is that 5'9" is 5'11".
Yeah.
like that would be boy math.
Boy math actually has a function for body counts that like the f of x is you're a slut.
Yeah. I love that. Greetings and welcome to Ill Repute, a podcast about women and women first. I'm Sovereign Sire, a comedian, a writer, and Roseanne Barr's social media manager.
Is that true?
If someone let me be their social media manager, that their career would pretty much go in the toilet.
And I'm Ella Darling, an ex-librarian, a VR pioneer, erstwhile, and entrepreneur. I use my cash gash, and I
love
I
that.
don't have more rhymes for that.
Cash gash is pretty good.
Thank you. It's like my new favorite word for it. It's just I can't say it to someone who's about to fuck me because it feels like too real. Leave something to the imagination.
It's a science. Women have to pretend to be ugly in order to be perceived as funny. They can't have a boner and laugh. It's like wild.
This is why I do it during sex, because they have to laugh if they want to continue having sex with me. It's a social contract that their dick signed without their consent. I call myself a lay down comedian.
I love it. So here on Ill Repute, our priority is women and women first. We support women's rights, but more importantly, we support women's wrongs.
You're goddamn right we do. And today, I want to discuss a woman who took a deadly beast, since domesticated, and harnessed its power to be used for witchcraft by women across the globe.
That sounds like a hero already.
It's definitely near and dear to me and you as well.
Set the scene.
Okay, it's 1983. And our heroine, an ophthalmologist, is treating a patient with a condition called blepharospasm. It's a very painful neurological disorder that causes involuntary muscle spasms and contractions of the eyelid. After administering a neuromodulator, which is something that sort of relaxes and affects the muscles, which was also a procedure she had performed many times with this particular patient, she discovered that her patient was angry with her, because she had neglected to treat an area between her eyebrows. So her doctor, a good doctor, apologized, and she said, "I'm so sorry. I didn't think that you were having muscle spasms in that area." And the impatient patient said, "I know I'm not spasming there, but every time you treat me there, I get this beautiful, untroubled expression." And this is how Dr. Jean Carruthers pioneered the cosmetic use of botulinum toxin A, and thus Botox was born.
Wow. So rarely are we present for the birth of a unicorn. I would venture to say birth of a Pegasus. This bitch had wings.
And we fly upon them. Now, I just want to say real quick before we get too far into it, because in my research, a lot of bitches like to bury the lead. I get Botox. I love Botox. And if you don't like that I get Botox, I am going to rage gracefully at you because you can go fuck yourself. So just so we're clear at the front, because a lot of the opinion pieces I've read about Botox written by women are just deeply like shameful that they get it. They have to couch it in like 40 minutes of going back and forth about like, but is it feminist? I think I'm a bad feminist. No, I think it's actually feminist though. Like, do it. It's your fucking face is what it is.
And let me say this. You can be anti-capitalist, right? But as long as you are living within a capitalist society, in order to survive, you must still play the game. Like that is a given, right? And feminism, we can fight a system that says women are judged by their looks, but while we are currently in that system, we still, to a degree, need to participate in order to remain socially current and valuable enough for our other message to push through. Like
to be heard.
Yeah. You can critique the system while still having to play your part in the system to whatever degree.
Savi, will you tell us exactly what the Botox is?
I will happily do that. Botulinum toxin, which is Botox's legal name, is a neurotoxin derived from bacteria, and it is one of the deadliest biological substances known to humans. You may be familiar with the illness it causes called botulism, frequently associated with food poisoning. Symptoms of botulism usually start with weakness of the muscles that control the eyes, face, mouth, and throat. Left untreated, it can lead to respiratory and muscular paralysis and eventually death. That muscular paralysis is the symptom that turned this plucky pathogen into the most common cosmetic treatment in the world.
In the world.
And here's the thing. People will, how can you put poison in your face? And to that I say, do you never drink wine? There are so many things and even medications that used moderately have a very positive effect. And then when used in excess, have a very toxic effect.
It's almost like the dose makes the poison.
Exactly, right? Too much oxygen in your air can become a problem, right? Yeah. This idea that something's toxic all the time, it's not. Some things in small measure are beneficial.
I will say it is the one application of homeopathy that I've ever heard to be like scientifically successful.
Ooh.
Because, I mean, when it gets right down to it, Botox is a very, very, very small amount, minuscule amount of botulinum toxin. It's incredibly diluted. So it's not like you're pulling a dented can from your grandmother's pantry and eating that, which it was a common cause of botulism in the past. I think that they've lined cans now, so that doesn't happen anymore.
It naturally occurs in honey and like listeria, which comes from hot dogs. Like pregnant women can't eat hot dogs. There's all kinds of things that we consume regularly that have potentially like deleterious side effects, or I don't like the word side effects, have deleterious effects because like they're all effects. There's no such thing as a side effect. Like they're all effects. Like,
yes. I'm glad that you mentioned honey because there is botulinum in some honey, and the risk of botulism is why you're not supposed to feed it to infants under 12 months.
Yeah, it's especially raw honey. So you can feed infants honey, but the thing is, especially with like the health movement, there became this emphasis on things like raw and the idea that raw equaled better.
Yeah.
And so there are people that would go get raw honey that's like taken from the apiary and put in the jar and sent to the store. Right. And that's where the real problems. Raw milk is illegal, but there are people that believe in it, right? Yeah. And so there's small dairies that will small batch like raw organic milk and go deliver it to people. And like, you should absolutely not feed that to children either. Like
100%.
Very dangerous. Yeah.
In fact, many adults as well. Okay, so infants are particularly sort of susceptible because of their stomach acid. They don't have a lot of bacteria in their flora. Infant botulism, and I discovered this in my research, and I shit you not, is called floppy baby syndrome. Doesn't that sound like a nursery rhyme of a horrifying condition? Like this, I mean, it's only recently has the death rate of some, like, and I don't know what it is for infants, but it used to be basically a 50% survival rate of botulism. Now it's down to 95% survival rate.
Oh, good.
But that's still a 5% risk.
So like we constantly consume products that could potentially be lethal, but are not in regular doses.
Yeah, I'm drinking caffeine right now.
So the first clinical use of botulinum toxin, let's just call it BT from here on out, was explored by Dr. Alan Scott in the 1970s. He was attempting to identify an injectable substance that would weaken the eye muscles and correct misaligned eyes. Dr. Jean Carruthers was Dr. Scott's academic fellow. It's so hard for me not to say, Dr. Scott, Janet, Brad. Okay, I got it out. I got it out.
I really want your boyfriend to walk into the room just so it's like really sexual.
I know. Dr. Jean Carruthers was also Dr. Scott's academic fellow, and he trained her personally on the procedure in San Francisco. Well, I bet he did, Brad. She returned to Vancouver and lobbied for the therapeutic approval of the drug, which she used clinically in her practice to treat ophthalmological disorders until the fateful day she encountered the aforementioned angry patient.
Dr. Jean and her husband were sort of a clinically trained power couple. So her husband, Alistair, he was a dermatologist. And after this sort of light bulb moment that, the patient just wants her face to look a little bit more serene, she brought the idea to her husband of using Botox and utilize this gift from this goddess that we now know it to be today.
Manna from heaven, a spiritual gift.
It's a spiritual gift.
Yeah, I mean, another saint,
yes.
A prophet, a second Moses, let us say.
Kind of better one. I mean,
talk about a traitor to his gender, and we like that. He has allowed women who already have makeup, and clothes, hair dye. Ugh.
How are you supposed to take them swimming on the first date if it's under their skin?
If it's Botox. This man is a traitor to all of his brethren, supporting and encouraging and assisting rebel women in their complete and utter subterfuge against the male sex to try to win control and power over themselves. What's next? Power over men?
This man is the reason I've been a successful cougar for like over a decade.
You've been 25 in the face for like 10 years.
I have joked every birthday since I started getting Botox that I'm turning 27 again. Oh my gosh, a decade of being 27. Because fuck you. What's my age? None of your business. That's why I called it witchcraft. It's straight up. It's prestidigitation. It is.
Mm-hmm.
Yeah, it's a spell.
Yeah.
Can you tell us what Botox is, like what Botox, not BT, is, and what it actually does? Because we're gonna get to what it isn't and what it doesn't.
Oh yeah, because that's real comedy. Botox is a purified protein derived from BT. And in cosmetic use, it's injected into specific facial muscles to temporarily block nerve signals, which reduces muscle contractions that lead to wrinkles. Botox is commonly injected into areas like the forehead to soften horizontal lines, and around the eyes to minimize crow's feet, and around the mouth to reduce fine lines. The goal is to relax specific muscles, offering a smoother, more youthful appearance without sacrificing natural expressions. So if you see someone and they can't move their face, that's not what it's supposed to look like. That person is overdone.
Yes.
Like the idea is just that it keeps you from being able to contract into these so when I would do it, they'd say squint really hard.
Yes.
Raise your eyebrows really, really, it's meant to minimize these really expansive expressions.
Yeah, they want to see you exaggerate your muscles so they can see how much movement you have. And that helps them understand where to place it. Because what it does is it blocks acetylcholine. And that's the mechanism of action that sort of causes your muscles to soften, to freeze, sort of. And
you're such a little STEM baby. You're my cute little STEM princess. You just said what did you say? Osceolic?
Acetylcholine?
Acetylcholine?
Yeah,
Bitch.
It's a neurotransmitter,
Yeah, you should do ASMR that's just you reading scientific words. Idea for OnlyFans.
I'm just going to say, theoretically, I might sometimes really like giving a handy J and just literally just talking about stuff from the podcast and just bouncing ideas while I write a script. And I feel like the handy J is the tax that I'm paying.
Oh my God. So every script you're turning in is certified hand job.
Not every script, because the dick is not always present. And I'm a one dick kind of lady. And what a dick.
I just like the idea of this is hand job certified. Thank you.
Uh-huh. Yeah. It's got the mushroom stamp of approval.
Yeah. Made by a genuine whore.
So go back to the topic. This is why if you are going to get Botox, you want to make sure that you're going to somebody who does a good job. You want to see reviews. Ideally, if you can, you want to get suggestions from people whose faces you already like. Botox is frequently conflated with other cosmetic procedures. It is frequently used by the uninitiated, we'll say, as a trusty catch-all label for any sort of observable results of a variety of unrelated treatments. So here's a few things that Botox isn't. It's not a dermal filler like Juvederm, which uses hyaluronic acid to retain water and add volume when injected into areas like the lips or cheekbones. Specifically, it is something to add volume. It is a filler. It fills in space. So like you can get it in your cheekbones, like up here, it kind of lifts a little bit. And if you don't know, you shouldn't guess because it's none of your business. But this, like having that injected in your cheekbones can cause a little bit of lift, which can have similar effects to having Botox around your mouth because it can sort of like decrease some of the wrinkling around your mouth. But very different procedures, different shit. If you see somebody who has really big lips, like just the biggest DSLs, like just real lips, some dick sucking lips, that is Juvederm. Botox can go around your mouth, into the muscles around your mouth. Juvederm actually fills your lips and makes them plumper. So somebody whose lips look temporarily like Sovereign's do all of the time, that's probably Juvederm. If they look like Sovereign's all the time, they can go fuck themselves because God plays favorites, and that's not fair. You dumb whore.
And that's the thing too, is like everyone has like their preferences around and the things that bother them or don't bother them. I think that's what's more feminist, having autonomy over the face that you're showing the world.
Yeah, absolutely.
But it should be said that this is a conversation of privilege. It's not a cheap procedure.
It's not.
It's like probably the cheapest.
Tell us about facelifts. That's another one that when someone gets a facelift, some people just love, oh my gosh, she just has too much Botox.
Botox is not a facelift. A facelift is a surgical procedure. It has a recovery time of 6 months to a year. I had a friend that just went to Turkey and got one. They're very open about it on social media. The basic recovery was 6 weeks. And then it's like 6 months to a year for it to fully like settle. If you see a fucked up facelift, it's because it hasn't settled yet. It's not just cutting the skin and stretching it, which is what a lot of people think it is. It's cutting the skin, then going in and taking the muscle and reattaching it back up higher where it was when you were younger. Then trimming away skin and reattaching it. Not all facelifts are even the same. A facelift is a catch-all term for a variety of procedures, and what people get depends on what their face looks like. Like if I went in to get a facelift now, they would probably give me like a temporal lift that would do like this, but they probably wouldn't do a forehead lift because my eyebrows are high and all of that already. And someone else, they might do like a neck lift, and another person their neck is fine. So even a facelift is not the same procedure from person to person. So if you see someone that's had a facelift, you have to ask like, well, what did you have done? And they'll usually list off like a package of procedures that were all done at the same time. But even that is a specific recipe. You can't just go down, you can't just walk into the doctor and be like, I'd like a facelift. Like
Not a chop shop.
It's not. And everyone's different, and like what needs to be done and how invasive that is, and like the recovery time. Like it is a significant medical procedure.
What you have to be put under is a surgery, and like any surgery. And I think that people don't ascribe the same they don't approach it with the same gravitas because it's cosmetic.
Anything where you have to be fully anesthetized is a very serious procedure. Botox is a simple injection. The only thing that you have to do is you might get some bruising around the injection sites. Some will suggest you to massage it because usually what they do is inject it. It forms like almost like a bubble. And then if they're a full service one, they'll sit there and knead it out for you. The only real thing you have to worry about is not laying down or exercising for 4 to 6 hours after you've had it done, which can be hard because I find that every time after I've had Botox, I do get a little sleepy.
I always want to go home and take a nap. The other thing, like as soon as I'm walking out of the office, like right afterwards, I always felt like I had little bee stings on my face for about 90 seconds.
Some will like let you walk out without them needing it in, and they just let it dissipate naturally, and you kind of look like a Klingon.
It goes away fast.
Yeah, it goes away really fast, but like it's funny. What else is it not? It's not a facelift, and it's not
Juvederm, and we kind of touched on this, but it's not a surface treatment like microdermabrasion or chemical peels, which exfoliate. So microdermabrasion is a combination of physical, which means it's helping to remove the skin physically, and chemical exfoliation, which is a chemical peel, and a little bit of microdermabrasion, which uses chemicals to basically remove the dead skin. Both of those are things that people incorporate into their daily skincare regimen at much less intense levels. What they do is they improve texture and tone. They can be good facials, but it's surface level, and it will only be surface level. Similar to laser treatment, which resurfaces the outer layer of the skin, and it can improve skin tone and texture, apparently, maybe through creating scar tissue that just kind of creates a little bit of volume underneath. It stimulates collagen production.
Yes, that's the story. There are a bunch of risks involved, but they're all very minimal. The things that most likely are going to happen is bruising, like probably at least one, usually the size of like the eraser on the end of a pencil.
Yeah.
Right. Mild headache. I've never had that one. Very rarely flu-like symptoms.
I've never had that.
I have never had that either. And then in some cases, Botox can migrate beyond the injection site, causing like eyelid drooping or other muscle weaknesses. And those usually resolve pretty quickly. I think it's called ptosis is the scientific word for it. It will resolve on its own, but you might have to kind of look like you have Bell's palsy for like a few weeks.
So there's some dangers.
Yes. Then there's these motherfuckers. So in 2006, a couple, Stephen Lee Sheldon and his wife, Deborah Martinez Sheldon, operated a med spa in Las Vegas where they sold cut rate deals on Botox while actually administering a research chemical called Tritox, which was sold for research purposes only, not for human use. This resulted in 4 cases of botulism with patients. And I think everyone has probably seen the meme of the lady that was doing butt injections for people and then got arrested because someone had like a toxic shock response because what she was using was tire sealant.
Oh.
And like, but her mugshot, because she was also administering on herself. And like, it's very famous because her mugshot, you see this, like, you see body dysmorphia on display. You see someone whose hips and ass have been injected out to like, I mean, it looks just crazy. And that's especially a problem with women pursuing beauty treatments and then trans women seeking gender affirming treatments like filler, right? Beware the discount. Beware anything where you're going into, there's not a lot of licensing around what can call itself a med spa. And understand that an injector can go through training, but it's not the same as being a doctor. Usually your injector is going to be under the supervision of a doctor. So like a lot of med spas, you'll go in and there's like a doctor that has put their name on it. Where I go, there's a doctor, she's great. If one of her estheticians took a course over the weekend, right, on like how to inject, they could work as long as they're like under the supervision of a doctor. And we all know how that goes.
Right.
Like just because someone's name is on the building doesn't mean that they're there watching every procedure, right?
Okay, so these motherfuckers, they got popped and they led to their supplier being investigated. And from there, 31 arrests were made, 29 convictions of various, like I think there were 4 or 5 doctors in New York, like really prestigious, auspicious doctors in New York who were arrested for this. And it is suspected that nearly 1,000 patients were unwittingly administered the counterfeit Botox, which like I have gone to some very like disquietingly discounted Botox joints in like Chinatown area of downtown Los Angeles. And at the time, the worst case scenario I thought is maybe they're actually giving me like Dysport or Xeomin instead of Botox, which is cheaper than Botox. So like maybe they're giving me that, which is still, they're both made from botulinum toxin. They're really comparable. So in my mind, like, oh, maybe they're not giving me the brand name Botox.
Did I tell you about the Russian lady that used to do my Botox?
No.
And she had a house that was in, if I remember, it was like in West Hollywood. And it was like this weird kind of duplex converted type situation. And I would go in and she had like
I hate it already.
She had 2 Great Danes and they would come greet you. I'm on board. I'm like,
Yes.
Oh my God. Yes, thank you.
Yes.
Then she would lead me in the house and it was very Russian, like Russian carpets and like all the Russian, like she was Russian.
Yeah.
And she used to tell me, and then we would pass by this workout room where 2 yoked blonde Russian gods would be like working out. Those are my sons. Oh. And then she would do my Botox and she would tell me stories about, yes, my husband, he was, how you say, disappeared. So we had to come here for safety. So I do this now. And those are my sons. They are getting strong. They want to go back to Russia. It was really cool. And I was like, oh, fuck. Like I'm in the middle of intrigue. I came for Botox. I got intrigue. I got dogs.
You pay for your whole seat. You only use the edge.
Now I look back on it. I'm like, are you fucking crazy? Are you fucking nuts? But at the time, like, you just assume nothing's going to go wrong. That's the mindset that we have to get out of as consumers. It's always important to vet people. Go check their Yelp rating. Go look them up on ZocDoc and just see what their rating is. You know, I've had a couple of bad experiences with doctors and then I went and looked on ZocDoc and there were all these horrible reviews. And I was like, dummy, you know?
I'll do it. I also just want to say the person I've trusted the most and like the ideal person for me is Dr. Manis. But what
He's
I have learned is having a doctor do it isn't always the best. He's the best because he's Dr. Manis.
Yeah.
But a lot of places, the doctors aren't doing it enough. It's not their specialty. They're very broadly focused, frequently on surgery. This is the importance of finding someone good. You want them to be on your care team.
I do think I need to go in. I was putting on my winged eyeliner today. And when I was holding the mirror right here, I noticed the line. And I was like, we're all going to live into our 70s. That's a long time. And when you see girls freaking out about turning 30, I'm like, bitch, you're not even halfway done. You have a long way to go. If you could only have one car your entire life, right?
Mm-hmm.
Maybe if you're rich or whatever, you can afford to go get a new car whenever you want. But let's say you've got one fucking car, right? And unless you're super wealthy, that's like what you've got. How good would you take care of that fucking car? I have yet to have someone get in that car and not ask like, is this a new car? No, it's not, because I've taken impeccable care of that fucking car because it's the one I've got. And like, I want it to last literally as long as possible. I probably spend, a couple $1,000s a year on it in terms of just like maintaining its appearance and its internal upkeep. And that's how I think of things like Botox or whatever. Not only we're going to live to be into our 70s, but we're going to be like vital while we're doing it. Like we're going to be active. We're going to be going and doing things, going to concerts, like things that like previous generations just weren't. Right. And so it's even more than ever. It's like, of course you want to preserve what you've got.
Absolutely. Women live on average about 6 years longer than men in the United States. We should be able to look good and feel good if this is what we're saddled with.
And also, too, it's like we're just living in different... I was looking back at my family tree and it was very depressing because everyone lived into their 90s. I don't even want to do something fun that long, let alone live. They weren't drinking. They weren't smoking. They were farmers. They were not being exposed to the environmental toxins of living in a city. Cities weren't as toxic as they are now because they weren't as crowded. I mean, in some situations, the hygiene, so there was more communicable disease. But in terms of bigger environmental things that attack our cells, right? Like weren't as prevalent. And so, living in the environment we live in now, we're like getting access to whole foods, getting access to clean air and clean water, being free from stress, having a sense of purpose, having a sense of community. All of that ages you. All that stress, all of it. And so, you can't change the environment. So you have to combat the environment however you can. Because if we could change the environment, like me and Ella would have done it by now. Thank you very much.
Yeah. Yeah. Still working on it.
Mercedes for everyone. 4-hour work week. Everyone gets a Mercedes. Everyone gets a PhD education. And everyone gets to eat like good food and clean water. Like that's how we would do it.
Yeah. Yeah. Lunch break and masturbation break, both guaranteed.
Exactly. So Botox is used for more than aesthetics. The FDA has approved Botox to treat a variety of conditions such as migraines, cervical dystonia. That's when the neck muscles contract involuntarily, causing your head to like twist to one side.
I've had that for about 12 to 18 hours a couple times. Like I've had episodes of that a few times in my life where I all of a sudden, it's like I was stretching and I literally couldn't turn my head further. Throughout the day, I'd regain motion. I have no idea why. I don't have the kind of health insurance that tells you what's wrong with you.
It treats a variety of muscle spasm disorders. So also hyperhidrosis, that's excessive sweating, overactive bladder. We all know what that is. Incontinence, we know what that is. As well as strabismus and blepharospasm, which we went over earlier. That's the eyelids.
Strabismus is like a cross eye or lazy eye.
Okay. As the good doctors originally utilized it, less conventional applications of Botox include treatment for TMJ, which is it's a muscular. TMJ is a very painful condition, and it involves like you have a joint right in your jaw, and it has a layer of buffer, like a padding, right? And for some people, that padding through just excessive grinding, it like goes away, which means that when they're moving their bones, like they're grinding bone on bone. That protective meniscus has been, that cartilage has been worn away. Incredibly painful. Another thing it's treated for is what RFK has. RFK, the supposedly presidential candidate, supposedly Democratic candidate. But if you listen to his speeches, he has a very kind of gravelly, strained voice. It's a kind of a dystonia in the throat, which affects the vocal cords. And like he has said that like the longer he talks, the more it kind of goes away. They don't know what causes it. It's like could be stress induced, could be whatever, but it mainly manifests in having like a voice that kind of sounds like you have laryngitis or like you've lost your voice. And they can treat that with Botox as well. Wow. So yeah, so there are like a lot of really important medical uses for it.
Yeah.
Even vaginismus, so they inject it in your hoo-ha?
Yeah, so I have a friend who experiences vaginismus, and it's basically the muscles and stuff in her vagina are just very, very tense. And so it's very painful and difficult to have sex. Even when she wants to, even when she like very, very enthusiastically, it's just very, very painful. And so Botox injected into those like surrounding muscles made it so that she could actually have sex comfortably, enthusiastically, pleasantly, orgasmically, even with her partner. And just from her account, one of the best things she's ever done for herself.
So like
it is also very hard to find a doctor who will do it. So as long as there has been cosmetic Botox, there have been hand-wringing think pieces waxing philosophical about whether Botox is feminist. In the paper, No Longer Raising Eyebrows, The Context and Domestication of Botox as a Mundane Medical and Cultural Artifact, authors Peta Cook and Angela Dwyer note the duality of feminist theory on cosmetic procedures like Botox. On one side, the feminist perspective views cosmetic procedures like Botox as a symptom of women's oppression in a patriarchal culture, offering narrow and unrealistic bodily ideals for women. Cosmetic surgery is criticized as correcting women's bodies to better fit within the ideals of femininity that are founded in real and imagined images of youthfulness and beauty.
They go on to contrast this with other feminist accounts, quote, challenging the notion that women are cultural dopes or puppets unsuspectingly enrolled into a patriarchal, oppressive, feminine bodily culture. Women are not tricked by patriarchal culture, but create and shape confident, adaptable, and desirable selves. They are called savvy cultural negotiators, attempting to make out as best they can within a culture that limits their options, unquote.
They note that our understanding of Botox as a technology is influenced by Foucault's... Wait, how do you say his name? I only have... Foucault, thank you. I've never said it out loud because I know I'm not going to say it right. So
he's a very seminal queer French philosopher that profoundly has shaped pretty much all critical theory.
Yeah.
His seminal work was Discipline and Punish. Another one is Knowledge/Power. I think he had one that was like the history of ideas. He's got one like the history of sex and sexuality. Yeah. But he's a post-structuralist, like deconstructionist, basically. That's who Foucault is. He's very, very important French guy.
They refer to Foucault's technologies of the self. These, and this is a quote, these permit individuals to effect by their own means or with the help of others a certain number of operations on their own bodies and souls, thoughts, conduct, and way of being, so as to transform themselves in order to attain a certain state of happiness, purity, wisdom, perfection, or immortality. And while Foucault's support is appreciated, the opinion pieces that I came across in my research were this really bizarre mix of, I like getting Botox, but I feel bad about it. Or I like getting Botox and you for making me feel bad about it. Or like a whole bunch of like, you shouldn't get Botox. And if you do, you should feel bad about it. It's just a lot of guilt and shame and a lot of people burying the lead about what they actually think. And so many of them are this outward performance of women grappling with the decision to do this thing that they want to do because they think it makes them a bad feminist. And as someone who has been called a bad feminist because of my career, because of what I do with my body, because of what I don't do with my body, because I married someone and I shouldn't have, or I had an abortion and they don't like it, or fucking whatever. If you're trying to live your life as a good feminist, just like the first thing you should do is realize that it's all a fucking gambit to just make us feel bad about ourselves.
Well, let me put it to you this way. Are they writing think pieces about feeling guilty about wearing sunblock, about getting enough sleep, about hydrating, about eating a good and balanced diet? No. But all of those are ostensibly to improve your fucking appearance. And that's not a female thing. Men use steroids. It's a huge controversy. It's a huge thing. Like everyone's talking about these older male celebrities. Yeah, they're all on fucking testosterone replacement therapy. That's not for their health. That's not for their health. That's so they can continue to bodybuild. That's so they continue to have energy. Men are pressured to have physically strong bodies that most people will not get through daily activity. They need to go to a gym or sit at home and set out to create that body. Men have been doing that since the beginning of time. Women have been wearing cosmetics, been using waist cinchers and all of the things since literally the beginning of time. We, on this podcast, read the Trotula, the first medical manual ever written, and was written by a woman. And half of it contains information for both men and women on how to be more attractive. We're talking the 1300s.
Like, fucking Ponce de Leon went on his, I believe, apocryphal journey for the Fountain of Youth. What, in the 1400s?
So he arrived, Ponce de Leon, I believe, was in the early 1500s.
In any case, it's not new. We've always been on this. Men also desire to be youthful. We desire to be strong and have the energy that we had when we were younger. And especially as we get older and we have all of the wisdom that life has given us, I think that we tend to want to be able to maintain our youthful exuberance in combination with like the wisdom that we have from life experience. Youth has been wasted on the young for time immemorial, and we're just finally finding a way to seize that a little bit back.
Yeah, pretty much. So what the ongoing discourse boils down to is either Botox is anti-feminist because, as Kate Cohen put it in a 2022 Washington Post article, quote, every choice to conform to sexist social norms makes it harder for other women to choose otherwise. Every woman who has plastic surgery or Botox or gets her hair dyed or, yes, changes her name makes it harder for other women not to, unquote. I would like to say the assumption that beauty standards are created by men and not women is super fucking funny to me. Women are the aesthetists. Like, we are the ones that care about how it looks. We care about beauty and presentation. The assumption that any beauty standard is sexist is ridiculous when if you go, okay, let me put it this way. In studies, men are attracted to 80% of the women they see on a given day. Young, old, fat, kids, no kids, blonde, brunette, black, white, native.
Yeah.
80%. 80% of the women that they encounter throughout the day, they find attractive in some way. Women only find 20% of the men they meet in a lifetime to be attractive.
Wow.
So who is setting the standards? Who do you think?
It's something that I found in my research. One of the arguments against it is that, men don't even notice it, or men don't even have a preference for it.
They don't.
And it's like,
they don't.
You're so close to the point. You're so close to the point that men don't get it. Like you're approaching the point, which is that it's not fucking for them.
It's for other women.
For them.
It's for other women.
Yeah.
It's for other women. Mainly try to impress other men, and women mainly try to impress other women. The call's coming from inside the house. It's our magazines that are filled with makeup tips and how to look younger, how to look flatter, how to look this, how to look that. You know, like men have a butt and boobs. Lips is nice. I like two eyes. Men's preferences are relatively simple.
On Reddit, whenever someone's like, hey, men, what is the most attractive trait you can find in a woman? Or what is something in a woman that makes you want to have sex with her? And every time, because it's Reddit, so it comes up like every week, every time the top comment or one of the top comments is, she wants to have sex with me. She enthusiastically wants just opportunity and desire and a little enthusiasm, everything else falls aside.
Also, the fucking mean girlism, because women are the ones that will come out to criticize other women. And let's be real. There's a lot of mean girling going on. Yeah. And women's standards are really high, and we want other women to like us and see us as valuable. We don't care what fucking dudes think. We want other women to like us. So we're the ones that are also setting standards. And that doesn't mean that men don't put standards on women, but that just tends to have way more to do with things that you can't fix with surgery. Preferring petite women. Mm-hmm. You can't fix that with surgery.
Right.
And honestly, for most dudes, that still comes down to a masculinity issue around size differences.
Yeah.
And reinforcing their sense of masculinity by being smaller than they are. Yeah. And that's what, and then they turn around and complain that women only want tall men. And it's you're the one that actually created that standard. You're the one that said that I can't be feminine unless my man is bigger than me. So, I guess go find some smaller bitches. We've been in porn. Mm-hmm. There's BBW porn. Mm-hmm. There's interracial porn, there's black porn, there's gay porn, there's gilf porn, there's fetish porn. There's a porn for every conceivable depiction of a woman. And there is someone that wants it.
And I sold cast fetish. Not a lot. It's a niche. It's not, believe you me, it's certainly not replacing my general income, but holy shit, when life gives you a cast, you make cast fetish, because if any unique thing about your body or not unique thing, that is someone's fucking fetish. That is their favorite shit.
Yes. So it's there's no kind of woman that some man does not want to fuck. Mm-hmm. There's someone out there that is into it. So this idea that men have created these draconian beauty standards, not quite. I can still relate it back to patriarchy. Which is women viewing everything as limited resource they're in competition with each other for. Mm-hmm. And so they create these standards in their own kind of competition with each other for what they see as the limited resources provided by men. Mm-hmm. Sure. So it's a psyop. It's a psyop.
There's patriarchal system, which we all live in and which we all suffer under. And I will blame men for a lot of shit because they're responsible for a lot of shit. This is, I think what you're saying is really, really important, because also it sort of relieves us of this false notion that women would try that hard and that we value men's opinions that much, because we see what they're willing to fuck. We see what they're willing to put their dicks inside of. They're not a good judge.
Well, that's why when
women's judgment matters. I trust what they think.
Well, when they say that men are visual, no, they're not. Why do their houses look like shit then? Why do they look like shit? Why do they dress like shit? Why is their hygiene shit? Why is it when a man lives by himself, his house looks like fucking dog shit? Why is it he doesn't know how to get matching fucking towels? Why is it that he doesn't know how to fucking clean his car? Why is it he doesn't know how to fucking dress? Because he's not fucking visual. Women are visual. That's why our shit looks nice. That's why our shit matches. That's why you have matching bra and panty sets. That's why we use Botox. That's why we wear makeup. That's why we fucking dye our hair. That's why our houses look fucking cute as fuck. That's why our cars cute as fuck. That is why we are cute as fuck. Because that's why we know how to dress. Because women are visual. We're the visual ones.
I put on makeup to record this podcast.
Me too.
You are going to see me.
I put on makeup and get fully dressed every day, even if I'm not going to leave the house, so that when my boyfriend comes home, I look cute. But also, in case throughout the day I need to go do anything, I feel confident that I look fucking good. Because I like to look good. Because I'm visual. I like so that when I look in the mirror, I like what I see. Like I'm visual to myself. Right?
People treat this like it's the apex of vanity to want to feel comfortable in your own skin, to want to like how you look, to want to feel good about yourself. And feeling good about yourself changes your whole day, changes how people interact with you. Even if it's just, I look good only to me, as long as I'm meeting my own beauty standards, I feel good. And when I feel good, I do good work. I am better socially. I have more enthusiasm for my day.
My thing is like, I put on makeup every day. I wear earrings. I have tattoos. I style my hair a certain way. I put on certain clothes because I like to decorate myself. And that's been true. So, like the first native peoples that were encountered by the Spanish were the Timucua in Florida, and they were tattooed from head to foot, like purely decorative. But like, and then some would have like fish bladder earrings, and it's like, they're like, oh, this is so crazy. And I'm just like, bro, you have a pearl earring dangling from your thing, and you're wearing a conquistador helmet that is pointed up for no fucking reason other than it looked good. What's so crazy about the fact that these native folks would also have ways they like to decorate themselves just to exist? Like we as human beings, like we like to personalize shit. And it's like, I like to do my eyeliner a certain way. I like to have my hair a certain color. I'm wearing an earring today and that's just me putting it on just to feel like myself. Yeah.
It really is. The way you look is one of the initial forms of control that you have over your world, over your life. Like you control your own body. It's one of the things that can be really triggering for people with eating disorders. Like feeling like you don't have control in your life can absolutely trigger a relapse, because it's like, well, if I don't have control over anything else, I can at least control this. Yeah. And people like to control their own shit.
Well, and here's the thing. Sometimes putting on makeup or getting dressed is the most creative thing I do all day. Yeah. I mean, I'm more creative than your average bear. So usually I'm doing a little more creating each day. But someday I like to dress up and do the things just because I'm creative. And it just feels good.
Makeup and nail art, it's all something that is really dismissed because it's something that women do, women are excited about. Yes. But it's an ephemeral form of art. Like it is literally art, and it's short and long lasting. And it's really, there's something really beautiful about that. But because it's on women's bodies for women's sake, it's frivolous.
Which is crazy. And my partner is a painter, a fine artist. And when I started painting, he was like, man, like you're so good with the fades. And then he was like, but like women are always good with that shit because they do their makeup all the time. And it was the first time that I'd heard a man acknowledging that like that's a skill. And it makes it makes it easier for women to pick up painting and to understand shading and color theory because we've been doing it to ourselves every day for like 10, 15 years. And so when we pick up that paintbrush, there's certain stuff that like we don't have to explain to us. We already know that warm colors make it look bigger, cool colors make it look smaller, that it's shading this way creates volume, shading that way takes away volume. Like no one has to tell us that. And I can draw a face so easily because I draw my own face every fucking day.
The other side of the coin of the feminist criticism from that Washington Post article that I had you read, which by the way was actually written, this woman was very upset that who was it, Jennifer Aniston or J-Lo changed her last name when she got married. I have feelings about, but anything that a woman if she's choosing to do it, and if she's a famous fucking celebrity, she's choosing to do it. Maybe just get the fuck off her dick about it.
In the words of Rihanna, your pussy is too dry to be riding my dick this hard.
Exactly. That's God. What a national treasure. The other side of the discussion is that, like we're saying, Botox is just like any decision women make about their bodies and appearance. It's an ongoing practice in agency and self-determination that should be seen through the lens of women making personal choices rather than women being personally responsible for upending centuries of oppression, which is a lot of fucking weight to put on me when I just want to fucking decide how to style my hair in the morning. It doesn't matter if it's for headaches. I get it because I want it.
Why is it incumbent on the people with the least amount of power in the system to change it?
Yeah.
And here's the thing. Women's life goals are often delayed by men. It makes sense that women would be more engaged in procedures because a lot of us don't get to start right out the gate like guys do because we're married, we have children, other things like that. It's a way of compensating for that lost time. You know, and then on top of that, men do all kinds of things. You won't find a single man that would not like to be younger. Hey, dude, if I could make you 30 again, like your body and everything, like give you all that, would you want it? Of course they would.
If you could look like you were 23 again, would you do it?
Exactly. If you could get raging hard boners the way you did when you were 17.
This is why Viagra is just available.
So men getting their hairlines done. Is that because we're in a matriarchy?
Yeah.
Women aren't the ones telling them. We didn't start making fun of men's dicks, their height, or their hairlines until we found out that men were self-conscious about it. And the reason that men always say women are ugly or fat, because they know it bothers us, because that's the shit we talk about all the time. Women didn't really care about whether or not he had a receding hairline or if he was short or if he had like the size of his dick until men revealed that these were things that they were sensitive about. Because within men, those are signs of a lack of masculinity or getting too old. And so my argument is that it is human nature for us to fear death.
Yeah.
We all fear death because we know we are going to die. That is what makes it precious.
Right.
And it is in our nature as human beings to fear death. So women get Botox and facelifts and boob jobs and go to the gym to get thin and whatever to maintain whatever youth they can have. Men get on testosterone. They get their hairlines redone. Like they go to the gym and build out these super muscular bodies. Like that is about fearing death. That is about fear of mortality. That is not about attracting a partner because every woman knows that all she has to do is walk out of her apartment and be confronted with like a blockade of trying to ease her life into chaos. Every day.
It's a fucking tale as old as time. Either you're a shitty feminist and you should feel bad because you're doing this thing, or you're gonna lose out on the benefits of some of the things that you get when you participate and play ball in a capitalistic society that you can't escape from. It's not up to you.
Look, I love to wear bows in my hair and pigtails. And I know that at a certain age that's gonna look ridiculous, and I hate that for myself.
See, I wear headbands and I don't give a fuck. I decided that I like feeling like a princess sometimes, and this makes me feel like a little tiara. And
You are.
I deserve that. And nobody gets to take that away from me because they can go f themselves. I have lived a life like every woman before me of people denigrating every fucking choice I make for myself. And if I made the other choice, I would be, shit talked for that too. So at the end of the day, you get to a point where you just have to stop fucking caring. Like, I can't please everyone. I'm not going to, as much as my feminine drive tries to make me please everybody. At the end of the day, I'm just going to do what the fuck I want, and we should all do what the fuck we want.
I love that Pamela Anderson has decided to just stop wearing makeup. And she has been the talk of the town at Cannes and at Fashion Week and she's like, I just wanted to like not distract from the clothes. I just wanted to wear my pretty clothes. And she's like, and you hit a certain age, you get older, and you just don't want a bunch of shit on your face. And so I'm not wearing it. I love that for her. Because I think more women need to see that you can, like, you don't have to look young and perfect. Like, you can look like who you are. And that is also fascinating and fun to look at. I also love Dolly Parton at 77 in a fucking Dallas Cowboys cheerleader outfit, a full face of makeup and a wig and platform heels. I love both of those. And that they're saying, if you want to wear no makeup, great. If you want to wear all the makeup, fucking fantastic. And I want us to not say shit about either one. The feminist thing is going, exist however you want to. Seeing people love Pamela Anderson doing that and love Dolly Parton doing that, to me was like, this is where we're making real progress. Because for me, it's more about like expression. Like, I want to feel like I could leave the house with no makeup on and no one would like make comments.
I stopped wearing makeup for OnlyFans for the most part, mostly because they're paying for the girlfriend experience and its authenticity and all that. And frankly, I'm fucking lazy and I don't have any social energy.
Yes.
And so if you want to see me on OnlyFans, you can see me never or you can see me without makeup. The people who have shit to say about it are people whose voices don't matter because their wallets are empty and their dicks are dry.
That's a quote. And why do females use botulinum toxin injections by Singh et al. In the Journal of Cutaneous and Aesthetic Surgery? The study suggests that, quote, females who use BT for aesthetic purposes are motivated by personal psychological gains, intrapersonal attributes, rather than social gains, interpersonal factors. So intrapersonal and interpersonal, two different things. In other words, they do not believe that having BT will equate to being treated any better by other people, but would rather provide them with confidence and satisfaction regarding their self-image. Yes.
Yeah. And so to conclude the episode, I really loved the conclusion of this paper, The Anti-Aging Trend, Capitalism, Cosmetics, and Mirroring the Spectacle by Kathy Beyer. For Georgetown.
Okay.
This actually might just be someone's like college paper. I don't know. But I really liked what she had to say. And so I'm going to fucking quote it. She says, with Americans living longer lives, working for more years, and dating at later stages of life than in the past, a perceived need to preserve the appearance of youth is understandable. Since youthfulness provides an edge in the capitalist workplace, and because images of youth and beauty are inescapable, Americans' dependence on appearance is nearly inevitable.
She goes on, the anti-aging trend is a result of the growth of capitalism and the expansion of the spectacle. It serves these interests only. Images in the media foster an aesthetic ideology of the masses that drives the consumption of anti-aging products and services. While individuals are capable of resisting anti-aging messages and forming alternative viewpoints, this action is overwhelmingly discouraged. The American cultural environment unapologetically encourages submission to the anti-aging trend.
So I liked that because it acknowledges that there is a very large, bigger than all of us force that is sort of at play here. But it also acknowledges that people aren't idiotic little theoretical participants in an experiment. They're real people with whole brains and the idea of free will.
They used to make this argument in sociology. It's not like people are just like an open vestibule.
Yeah.
That's just filled with whatever is in front of it. Like everything is still taken in through the context of lived experience, culture, whatever. And yeah, it's like, I love that this paper has acknowledged that ageism across the spectrum is a problem.
Right.
You're 50 years old and you got to find a new job. And when I've talked to older people that are looking for jobs, like their number one fear is they're not going to be hired because they're going to be perceived as being too old to be relevant.
Right.
So I appreciate that the thing is talking about, like, there are a lot of reasons to want to look younger that have nothing to do with attracting a partner and everything to do with like wanting to be treated like a full human being.
Operating within a society that has structures that you live within.
Yeah, exactly. This is great.
I'm so glad. Thank you.
Yeah.
Thank you.
I didn't know the history of Botox. So I want to close this for those of you that wanting to look young, because I'm a nerd and I hate extra steps. There are only 3 things scientifically proven to reverse aging. That is sunscreen.
Yes.
That is retin A.
Yes.
And that is Botox.
Yeah.
That's it.
Shit.
Only 3. So when people are like, oh, your skin, like, what do? I was like, I wash with soap. I put cocoa butter lotion on my face, and then I put on sunscreen. What do I do at night? I wash my face. I put retin A on, and I put on some cocoa butter. Like cocoa butter on your skin. I'm like, it's fine. I have dry skin. It's not too much for me to handle. And then I go get Botox every like 3 to 6 months. Because scientifically, those are the only things that have been shown they actually work. So the lasers, the microneedling, all of that stuff could be placebo, could be, because like the thing about the efficacy of things like that is they're relying on patients to say that they feel like there was an improvement. And most of the before and after photos, like, I'm going to be honest with you, a lot of those are touched. They're touched and retouched. Like it's not a reliable, it's just.
There's a lot of people in the skincare community love to do these kind of treatments just specifically for skin results.
Well, I'll tell you this,
want
like
actual wrinkles and aging results.
And the thing is, even if you have sun damage, if you start using retin A at night and you start using sunscreen and staying out of the sun, you can actually reverse that damage. All right, let's do some housekeeping.
All right. So I am in Austin, Texas. I am on the cultural land of the Tonkawa, the Comanche, and the Lipan Apache peoples. And they have been here far longer than colonizers and settlers. They've been caring for the land. They continue to this day because they are still a thriving culture and vastly contributing in an ongoing way to the wellness of the land that we live on. And we want to express our gratitude.
Yes.
And Savi.
And I am broadcasting from traditional Chumash and Tongva territory in Southern California in East LA. And just like Ella said, the original stewards of the land and a continued presence here today. Stay aware, stay woke, stay involved, and, help disrupt. They are, they're not protesters, they are protectors.
If you would like to let us know your thoughts, your insights, your feedback, and either polite or genuinely funny critique, you can email us at our email address, which is I know.
Which is illreputepod@gmail.com. We've actually been getting some really cute emails.
Oh my God, forward them to me.
I will. So, but yeah, love your feedback. And, if you have ideas for episodes you'd like, anything like that, not promising we'll do them, but always open to things we just hadn't thought of or didn't realize people were interested in. More importantly, as we're trying to grow this podcast, please, please, please tell your friends. Tell your friends. That helps so much. Go leave comments on Reddit, leave comments on Facebook. We don't have a discussion group because we felt like we didn't want to be responsible for moderating listeners. But if any of you feel like creating that kind of community, you're welcome to do it. And if you let us know, we'll come jump in and say hi and definitely participate. We just didn't want to put ourselves in the position of being in control of what people are able to say and not, we didn't want to put ourselves in that position. But if you feel like creating that kind of a space, we'll definitely promote it and participate.
We want to come correct with you, and coming correct is not controlling the conversation. We can start the conversation, but it's not ours to control, and our listeners have very valid insights and perspectives.
Yeah.
So we want you to be able to talk openly and honestly without feeling like mom are going to come and ground you.
Yeah. Or I feel like people are going to get blocked or banned. It's like it just becomes like kind of a whole thing. So,
yeah.
But if you feel like it, you want to go start a subreddit, like we will happily go say hi and read over it if you want to make suggestions or whatever you want to do, if you feel like it.
We've had people asking why we don't have a subreddit.
Yeah. And it's like, that's why. Yeah.
So follow us on social media. We are on Twitter, we're at IllReputePod. On Instagram, we're at WeAreIllRepute. And on TikTok, we are at IllReputePod. Now, if you want to follow the beautiful women, on Twitter, we are at Sovereign Sire and at Ella Darling.
And then
Darling. On Instagram, we're Sovereign_Sire. And I'm Ella Darling 69. And on TikTok, you're
Call Me Savi.
Call Me Savi, fuck. And I'm Ella Darling X, but I don't post on TikTok. I don't use it. So
Well, don't worry, guys. I'm gonna get her laced up.